Hello.
Hello.
There we go. There we go.
There we go.
Perfect. Pros. Uh-oh. Yep. Strike the stand. Well done. Thank you. I have one question completely unrelated to disinformation.
Yes.
Have you seen The Pit?
Yes. I've seen a bit of The Pit.
You like The Pit?
You know what? I didn't like ER, and I knew I wasn't going to like The Pit because it feels too much like work.
Sure.
However, there is another backstory. I wrote my first book was The Night Shift, and it was what it was like to work all the hours of a night shift, starting at 11 o'clock and ending at somewhere around 7 or 8 o'clock in the morning. And that book was and still is my most successful nonfiction book. And it got optioned by a whole bunch of producers and went through a whole bunch of showrunners, and nothing ever came of it. Then came The Pit. But of course, there's no plagiarism there. I'm also working, my fifth book is the sequel to The Night Shift called The Casino Shift.
Oh, wow.
And I handed in the first draft a few weeks ago, and hopefully it'll be published in 2026. Basically, it is an updated version of The Night Shift, new stories, but not, I hope, now I have to hope that it's the Canadian version of The Pit.
Yeah.
For God's sakes. But basically, it's an hour-by-hour account of what it's like to work, in my twilight years as an emergency physician, and against the backdrop of now waiting room medicine, waiting room code blues, and people quitting and burnout, and seeing people who come back from Brazil and Turkey with all kinds of horrible infections from plastic surgery operations that they've had, and all the modern stuff that we were dealing with, emergency department closures and virtual emergency departments and all that kind of stuff.
Wow. Sounds like a great book. Can't wait to read it.
Okay.
Truly.
All right.
All right. We could go to a lot of different ways with this conversation. I must say that I'm pinch hitting for Daisha Lopi as well, who is ill, who can't be here, a brilliant young journalist, and I know her and Brian spoke about this, so I'm sort of just stepping in here. Can you recall the first time that you were aware of disinformation in the medical space, and what was that?
Oh, where's Nick? That's a really good question. I don't think it was medical, in a medical environment. I am pretty sure. I would say that first and foremost, people who come to the emergency department are seeking what we have to. They want to buy what we have to sell. Occasionally a patient would come to argue about some weird take on pathophysiology. We get that. We've gotten that since I first started working in the emergency department 40 years ago. I think that my first major encounter with medical disinformation was as a medical journalist, and I think it was MMR. I think it was measles, mumps, rubella vaccine, and autism, and the link between the two. I was there. In fact, I was there covering the issue before it was MMR. Before that, it was DPT, diphtheria, polio, pertussis, diphtheria, polio, tetanus, pertussis, and there was an allegation in the 70s and 80s that whooping cough vaccine, pertussis, could cause a brain disorder called encephalopathy, and this was quite an issue in the UK, and it led to lots of parents not getting their kids vaccinated against whooping cough, and then they had a big spike in whooping cough, and there was a major public inquiry that was chaired by a learned judge, and eventually they came to the conclusion that it was more of a statistical anomaly than a real thing, and then by then they'd invented a new form of pertussis vaccine called acellular pertussis vaccine, and that seemed to zero the risk of this brain disorder. But DPT was also the name of an organization called Distressed Parents Together, and and this was the first anti-vaccination.
Give us a time frame for that.
We're talking about the 70s and early 80s,
Is that right?
and so that that crisis kind of came and washed away, and then MMR started, and that was the first time that I started to read and cover that MMR vaccine could cause autism. And it started with a sprinkle of cases and case reports. and you had parent testimonials saying that my kid was completely normal, and often kids with autism, even profound autism, are neurotypical until they reach a certain age, and then they become neurodivergent. And so that could just be a coincidence. But they said their kid got an MMR vaccine, and then they had a high fever and were incredibly irritable, and then they changed completely. Mm-hmm. And it was those case reports that eventually led to study, and I actually was here. We heard that before the Andrew Wakefield studies, that were, one of which was published in the Lancet. I'm sure you're familiar with them. They've been since debunked. A couple of studies that apparently conclusively they're both fraudulent. They both supposedly linked measles, mumps, rubella vaccine to autism. And they were published, one of them was published in the Lancet, and it just took off from there, just like wildfire. It took off. Eventually, the papers were retracted. The paper in the Lancet was retracted for a number of reasons. One of them being that the so-called randomization was not random at all. That there was a greater number of kids who had been recruited by parents who were suing, and so they belonged to a very, very particular biased cluster. And then the other thing is that Wakefield himself was collecting huge fees as an expert witness, and so the publication of in the Lancet did cause his expert testimony career to take off, and eventually the paper was retracted and he was struck off, as they say in the UK, by the General Medical Council, the equivalent to the Provincial College of Physicians and Surgeons. But he ended up in Texas, where he still does his thing.
They all end up in Texas,
and he has convinced RFK Jr. and a lot of other people. But I would say that was the first time and the place that people were peddling conspiracy theories, but none of it stuck in the way that we saw when social media became the major kind of lingua franca, became the medium by which people talk to each other, and COVID and all of the all the conspiracy theories that have developed and the alternate therapies that have developed since COVID and have not stopped.
Yeah, we touched a lot on COVID and the pandemic in the first session, so it's going to come up in our discussion. But I was wondering about medicine being a prolific breeding ground for disinformation, and why that is. One of the obvious reasons, I think, and you can refute this, but one of the obvious reasons would be it's fucking complicated, and a lot of it is misinterpreted, not from the medicine side, but from the non-medicine side. And I wonder whether you talk about Wakefield. Did you have a sense that it was going to get worse before it actually did get worse? And did it surprise you by how bad it become?
Oh, it totally surprised me. Oh no, I thought he struck off, his reputation's in tatters, and that's the end of that. And it wasn't. It wasn't. And I frankly I was covering this as a medical journalist. As a producer, like broadcaster producer, broadcaster at Sunday Morning and other shows like that, and on the health show. It was a TV show that ran in the 1990s for 6 years, and of course since White Coat Black Art since 2007. And I know we're going to use we could use COVID as a signpost, as kind of like the moment, like before COVID and since COVID, but there's no question that the seeds were being sown long before that. It wasn't COVID that caused all of this. This was all happening before. In fact, before COVID, we did lots of shows on White Coat Black Art on vaccine hesitancy. And by then it was the truism that people will remember the allegation of child sexual abuse, but they won't remember the apologies and the exonerations. They don't, unless it's David Milgaard, unless it's somebody whose story gets told as somebody who was wrongfully convicted. We were doing shows in 2016, 2017, 2018 about pediatricians in the United States who were being persecuted because they promoted vaccines. And it was worse in the United States than Canada. I remember going to Sherbrooke, Quebec to cover a program that was, and this would have been, I guess, just before the pandemic, around 2018, 2019. I went to Quebec to cover a story of a program in which a kind of a vaccine advisor would visit new parents in the postpartum ward to talk to parents about vaccines, and their specialty was turning around people who were nervous about vaccinating their kids. So what this tells me, Dave, is that first of all, during that period of time, there was already a wellspring of skepticism, fear, and I didn't spend a lot of time wondering where they were getting it from until the pandemic, and then by then it was obvious that they were getting it from social media. And this program, I remember, we talked about this the essence of this program was to not yell at, as was said in the questions, you fracking idiot, and what are you doing? Because that's your first impulse. When you're a physician, this is what you've been taught. You've been taught the scientific method, and there's just whatever they're saying is neither plausible nor is there any evidence to back it up. That you don't do that, because that's going to turn people off. The first thing that and I watched them go from parent to parent, and the counselor would begin by saying, first of all, not talk, listen. What are your thoughts? What are your thoughts about, have you thought about vaccinating your kids? And they would make sure that they met in one really important respect. So eyeball to eyeball. I know, they would say something to the effect of, I know you care about your kid, your baby, and you want to do, and I know, I can see that you want to do the best. You want to bring the best information, and you want to do the best for your child. So that you're not starting from a place of anger or disrespect or condescension. What you're doing is you're trying to meet them and empathize with them and what they're feeling right now. And I thought it seemed like a sensible program. And then of course COVID came in, and we weren't talking about the occasional parent who had a child. We were talking about everybody, the entire population, of which there was a huge segment that was now very, very skeptical about vaccines, because they were skeptical about public health. They were skeptical about any kind of authority figure who was telling them what to do.
Vaccines are and disinformation are, they're so close. And often when we do talk about disinformation in the medical space, we talk a lot about vaccines. But are there other examples of medical disinformation that are part of our? Could you could you do a bit of a laundry list for us in terms of?
Yeah, sure. So all you need is a healthy lifestyle to avoid cancer. Especially if that healthy lifestyle involves 3 or 4 drinks a week. Your choice, of course. Another one would be, getting back to vaccines. Certainly, I don't have to say vaccines. That cell phones cause brain cancer. There's been serious study that's looked at this question. It started as, could it be? Because cancer is a disease. It's a fairly common disease, and cell phones became very, very common. So it's not implausible that there might have been a link between one and the other. The chemtrails, that's another one. Hey, today, I was getting my car, getting my tires swapped. Finally got my all seasons on, and the snow tires off. And driving back, I was driven back in an Uber from the from the car shop, and the guy who was driving me said, "So what do you think? So what do you think did the?" I mean, I figured the guy was maybe 32, 33. He said, "Do you really think those astronauts landed on the moon?"
That's a good opener.
I don't know why and maybe he thought you're old enough to you were there. Sure, I was at Camp Northland and I watched the grainy images. Because we had aerials, we didn't have cable, and we didn't have a decent antenna. And believe me, I missed the whole damn thing. But I'm pretty sure that they landed. But he said to me, they went to the moon with Scotch tape and pencil and paper and computers that are like that are like adding machines, and it's like and they went to the moon for a few years and then they never went back. And we have all this technology today, and how come we haven't been back? So it must be that it was a fraud that they went in the first place, because we could go today if
That almost gives me, though, disinformation nostalgia. Like, I long for the days when it was only about the moon landing.
Yeah. And you asked about others. Well, certainly the one we have today is that all you need to do is be exposed to all those childhood diseases, and you'll be just fine, because it'll toughen up your immune system. For me, a lot of them are medical. The more diseases you have, you need it to tone up your immune system. Like, as if it's a muscle, use it or lose it. So you had this vaccine instead. So you didn't. So now you're really susceptible to some really serious disease down the road. And it's not a muscle. It's a memory. It just creates an imprint that if you ever get exposed to it again, you make a lot of antibodies, and then you don't. God, you know what? Hey, smallpox. Like, I have a smallpox vaccine. I still have the scar. I can show it to you. But people didn't want to get smallpox back then, and I'm sure we'll talk about the future. But what I think will end a lot of this kind of this misinformation, disinformation circus that we're in the middle of right now would be a rip-roaring pandemic that kills 80% of the population. That'll do it. That'll do it. Give me the vaccine, please, now. I'll take that mRNA vaccine.
Right. You, as disinformation has crested.
Crested? Did you say crested?
Jesus, Lord, let's call it a first wave. The wave is tall.
Delta?
Yeah, no.
Yeah.
Okay, well. Yeah.
I know what you...
No. Listen, maybe it hasn't. As it's kind of, become part of the public discourse,
yes,
for what it's worth. And social media, these guys talked about it earlier, just that, the pivot from it becoming a very nasty, dark place filled with all of these theories versus the ostensible public town hall. My point being, you were a very, prolific, active, lively voice still on these platforms, despite the fact that you're in a sea of disinformation. What kept you there, / keeps you there, and did that have an effect? That kind of life online have an effect on your life offline?
Oh yeah. So yes, it did. And by the way, I was also wrong. I followed the party line on is COVID airborne, and I was as wrong as the public health authorities who said it was not airborne. I wasn't in a position to know for myself until I started to learn more about it, and then I realized that we were all wrong. So I had the experience of saying one thing at one time on social media, then saying something else at another time, and getting busted, and rightfully so. I think that one of the things that it's probably worth talking about with COVID, from my perspective, both as a physician and as a medical journalist, during that entire period of time, was that we made, I think public health made pronouncements that were a little too definitive, a little too declarative. This is what it is. I think that public health did a lousy job, and by inference I did too, of inviting people to lean into uncertainty. Uncertainty, I think we would have, I think medical authorities would have retained more of their credibility had they been willing to be more uncertain at the beginning. It's a truism in the emergency department that, all of us need to practice with a healthy respect for uncertainty. Uncertainty meaning I don't know if the symptoms you're telling me are the symptoms that you're actually feeling. Maybe it's not your first language. If you look at the medical textbooks, they seem quite certain about the types of symptoms, symptom complexes, symptoms and signs. Symptoms are what you feel, signs are what we detect on a physical examination. These symptoms and signs always mean heart disease or ALS or whatever disease you're talking about. In fact, there's a lot of uncertainty in diagnosis. There's a lot of uncertainty in the value of the testing that we use, the blood tests, the ultrasounds, and the images. Two radiologists can look at the same image and not see exactly the same things, which is one of the reasons, we'll talk about this, why AI will eventually be essential for things that physicians can look at. And the point that I'm trying to make is that patients want certainty. The public wants certainty. And we haven't done a good enough job of teaching them that in the fullness of time we'll know. Mm-hmm. And on the other hand, you had a brand new novel infection, and people were looking for answers, looking for ways of trying to avert the disaster that they thought was coming, and it for unfortunately for many people it did. By the way, proportionally fewer people in the United States in Canada died than in the United States, far fewer. Mm-hmm. So we must have done something right, but we didn't know until in retrospect. And the airborne thing, though, being wrong about airborne meant it's interesting. I've been thinking about this just the last couple of days, thinking about what I was going to talk about today. You would think that once we said, "Oh yeah, COVID is airborne," that people would understand the need for masks. But by then,
right.
What was seen as what we saw in medical culture as correcting a mistake, the public saw as a flip-flop. Mm. Politically a flip-flop. First you wanted wage and price controls. First you said they're terrible. Now you're bringing on wage and price controls. What a flip-flopper. That means you don't know what you're talking about. And I wore a lot of that. I was criticized and doxxed and all the bad things that happened to you on social media.
But what kept you online despite the fact that you had to go through that?
I need a job.
Okay.
I need to earn a living.
Right.
Because COVID has ended. It's now in the rearview mirror, and people don't do this about cancer. Right. People don't do this about strokes and heart attacks, and I guarantee you the vast majority of people who will not take a shot, if they've got crushing retrosternal chest pain, damn it, they want that PCI. They want that fracking stent now. Why do they believe that and not the rest of it?
Right.
They are very selective in what they're skeptical about.
Do you, by putting forward these ideas on your feed, online, do you feel that it's a way of affecting change?
Just like Bruce and Alex said, I don't know. I really don't know. The truth, well, I do know. I think we're just talking to the converted. It's circular. We're just telling people, we're giving people information that is evidence-based, and it's what they want to hear because they accept evidence from the scientific community. The people who are skeptical think it's all bullshit.
Does the digital realm, or has the digital realm, I think you maybe hinted at it, but perhaps I'm wrong, but has the digital realm affected medical culture? For a while there, and we can talk still a bit about COVID, and then we can leap out of it. But for a while there, it seemed the medical community was almost operating the way a Basketball Insider would operate, being the first to identify what the strain was, or being the first to figure out what it was. There seemed to be a lot of, that frenetic pace. We're not used to the world of medicine operating like that. Would you agree with that? And if there are changes, what are those changes in the medical culture?
So there's two realms. There's the internal medical culture realm. That's healthcare providers talking to each other on WhatsApp, and sharing ideas, and not. And then there's the what you call the digital realm. You're talking about X, and physicians are mainly on X. They're not. I guess some of them have done TikTok videos and may have Instagram accounts, but they talk to each other. X is still a significant place for physicians to share ideas. The thing about X is that the public can listen in, and I shouldn't be a hypocrite, because on White Coat Black Art, what we want to be able to do is have people who listen to the show feel as if they're listening in on a conversation that we'd be having amongst ourselves. So I think the first impact is that we thought we'd found our communities on X, and so first of all, two things have happened since then. For some of us, the criticism has just been so strong, so profound, and so personal that it's forced a lot of us off X. So that's the first thing. So we're not sharing our ideas with the public in the same way that we did before. There's a few brave souls. Lenora Saxinger, she's an ID specialist, infectious disease specialist in Alberta. She's still doing it despite the criticism. And she'll put out these amazing threads on what you need to know about measles. But a lot of us have just learned to shut up. Thing about physicians is that they are stung by criticism. And the more personal, the worse. And they'll interpret anything as a criticism. So being told that they said one thing last year and they're saying something different this year, they'll try to explain it. But if they get a lot of personal comments about their integrity, then they're out. They're gone, because they are. Healthcare providers tend to be shame prone, and that's a good thing and a bad thing. It just makes them wake up at 4 o'clock in the morning wondering, what did I say wrong? What did I do wrong? On the other hand, it tells you that there's still a purity in medical culture. That shame stops us from lying. Lying has become, on social media, has become nothing. It's like, who cares about lying? There's a president who lies like 89 times a day. Is it 189 times a day? Daniel Dale is making a career being a lie detector and he can't even scratch the surface of everything that comes out of this guy's mouth, and he has no shame. There was a time when people, there were he utters 20 firing offenses a day, and nobody seems to care anymore.
That brings me to RFK Jr.
Thank you.
You mentioned Trump, so
we knew we were going to be.
I took Bobby to McCormick Arena years ago to play hockey with a bunch of us. Played. We had this game for him when he ran the Waterkeepers, and we went to. I've seen him speak many times, brilliantly, evocatively, poetically about the environment, and really held him in high regard. And now he's, his dissent has been equally as profound. I think it's also, we'll talk about measles in Ontario as well, but how do you quantify the effect that he is having currently on the medical environment in North America and possibly the world? And where do you think this is headed? And is it possible that it could all go up in a ball of flames, or is that me being too hopeful?
Well, You mean him or the planet or
him-
civilization as we know?
Yeah. No, I mean his theories being found out and basically realizing that he's a lunatic, or is that not even part of the potential landscape of
I
the
don't think it's
future?
even part of it.
Yeah.
Yeah, sure. He's now devoting I don't know how many millions of dollars. 15 research teams apparently looking for. It started with we'll have the cause by September, cause of autism by September, or we'll have now it's morphed into some answers. I think that's actually a quote. So he's kind of doing the Trump thing. You know, the tariffs are 145%. We'll stop them for 90 days. Maybe we'll bring them back. We'll cut them by half. It's
Right.
like it's dizzying. No, I believe. Now, there's two aspects to RFK Jr. There's what he says and what he's doing. And I don't want to forget what he's doing is far worse and far more important. If indeed it's he that's doing it, as opposed to Elon Musk or Trump or somebody else or Project 2025 that's saying get out of the government business. But what he says, he's giving comfort to the grifters. To the people who are in it to make a quick buck on ivermectin and vitamin A for the measles. But in that sense, he's a symptom. He's not. He's a symptom. He flourishes in a climate where disbelief is in ascendancy. So there's that. So getting rid of him wouldn't necessarily change everything. I mean, could you imagine another Department of Health? I mean, I was one of the first people that was calling for him to be impeached. He needs to be impeached. And I know medicine like I don't know defense. I don't know defense. I don't know economics. I know medicine. He needs to be impeached. Because what he's saying is in an acute crisis like measles can do a lot of damage. Then there's the other part, which is happening under his watch, under his auspices. And I don't know how much of it's coming from him, but the closing of departments, the canceling of grants. I was in Seattle at a children's conference. It was a rare disease conference, kids' rare disease conference. And the first guy I spoke to said, I just had 5 NIH grants canceled. And I'm going to have to fire 15 people. And it's research that was partway through. There was a 30-year study into women's health that was bearing fruit, and women were underrepresented in studies, and we're getting some answers. That study's been canceled. The early warning system, the Sentinel surveillance system, we're part of a world, and the CDC played an important part in deliberations by the World Health Organization. We relied on information from the United States here in Canada, and the eradicating of that watch. That system of oversight, that system of surveillance is scary, and we don't even know the half of it. And the drug approval process that's going to be changed and corrupted. And by the in the interest of fairness, some of the things that RFK Jr. is proposing, that kids would be healthier by eating healthier foods. Yeah, sure. I agree. Some of them are great ideas. Even Trump has great ideas. I think the book on him is The Right.
Hold on, back up the truck.
Back up the truck, but the right diagnosis, the wrong treatment. He just doesn't know how to treat things. He's just sometimes he sees things that other people don't see.
Yeah, right.
And we got 10. By the way, we've got under 10 minutes.
Okay,
we're watching carefully.
Okay, we'll move fast.
Right.
One thing, we saw with the pandemic, we saw with COVID. How hard it was to convince certain parts of the population to, get the vaccine. But disinformation in that early days isn't really where it is. It's much, much worse now.
Right.
What does it look like, heaven forbid, should another pandemic come down the pipe? And how worried should we be in relation to disinformation?
Okay, so first of all, I think it's fair. I can say them both quickly. Let's start with measles. Canada had all but eradicated measles by having high vaccination rates in the country, and sporadically people would arrive on Canadian shores with visitors from other countries with a case of measles, and maybe they didn't have the obvious rash, they just had the some of the premonitory symptoms, the catarrhal phase, the runny nose, the high fever, but their chances of infecting somebody, finding somebody who was unvaccinated, were so small that we could take it. And we've always had groups like the Mennonites who, as a matter of religious principle, don't vaccinate their kids. But it wasn't a problem because because we had so much other immunity, herd immunity, that the odds of somebody who was infected arriving in a Mennonite community and infecting and causing a local outbreak were that low. Keep in mind, though, that measles is a serious disease because one person who's infected can in turn infect as many as 20 other people. But now, we need to have around 95% immunity, like people who've either had measles, like me, or who've been double vaccinated, to have herd immunity, which means that the odd case isn't going to cause an outbreak. That's not happening now. We now have much lower rates of vaccination in Alberta, rates as low as 69%. That will not do, and what we're seeing right now is 129 cases there. That's just the beginning. It's going to be really big. Now, about the pandemic, about the next pandemic. Certainly, I've been watching bird flu carefully. Bird flu has it has infected a number of species. Obviously, birds. It's infected a whole bunch of mammals, and each time it infects a different species, it's learning new tricks on how to evade the body's defenses, how to become more lethal. I don't want to say that the case fatality, and some humans have been infected. We had somebody on the dose talking about bird flu early on, maybe a year ago, or maybe 8 or 9 months ago, and on paper, in theory, the fatality rate could be as high as 30%, 40%. It's some really high percentage. The problem with that statistic is that we don't know how many humans got bird flu and simply never went to a doctor, were not reported. We're not doing the surveillance studies that you need to do, at least in the United States, they're not doing them. The case fatality rate may turn out to be much, much lower. But they're worried. Flu watchers, virologists are very worried about this one because if it learns a few more tricks and can spread from human to human and has, a 20% case fatality rate, I said 80%. That was a sick joke. 20% would be very, very serious, and then you would have, the carnage across, cutting a swath across Canadian society would be unbelievable. Now we do have a couple of bird flu vaccines that could be rolled out in a hurry, but you'd have to ramp up production. We've ordered a few. I think the UK has purchased or planned to purchase 5 million doses. I don't know about Canada. I know Canada was talking about it.
Well, we can at least take comfort in the fact that birds aren't real.
How long have you been waiting?
We'll be fine.
Lay that one on us.
I think probably we can jump to questions because, first of all, Brian Goldman, everybody.
So we're going to jump species to the audience.
Exactly.
Okay.
Hollis will take care of you with the microphone. If you have a question, just put up your hand and we'll get you in here.
Oh, I see one way back there. Oh, I see two.
Hello.
Hello.
First, I have to say that you saying that you were wrong about something and then correcting yourself is very impressive. It's not easy to admit when you didn't have all the information of today. So I am curious about asking, what it took to admit that you were wrong, and then I am always curious if we're creating people that are very obsessed with themselves and we're creating this society where it's ever increasingly harder to admit that you were wrong. So are you finding that we're creating more narcissists through our society, and what are you seeing in the medical field? Because I think you gave a really good example of a doctor who continues to talk about what they're finding, but other people are backing away. So is disinformation creating a bunch of narcissists, and how do we combat that and protect normal people?
So there's a number of questions in there. Social media creating, or is disinformation creating a bunch of narcissists? I think it's the social media aspect that allows their voice to be instantly amplified. And I mean, I have 100,000 followers on X, and I used to think that was a lot, but it's not. There are people who are a third my age who have several million followers, and there is something intoxicating about having a whole bunch of people hanging on every word you're saying and reinforcing what you're saying by agreeing with it and liking it, etc. So I think that didn't exist before. That didn't exist before social media. Maybe it did on a much smaller scale. Now back to your other question, admitting that you're wrong. I did a TED Talk about 2011. Doctors make mistakes. Can we talk about that? And I talked about my own mistakes. And I had to go. I used to be very ashamed of the mistakes that I made, and there are. I don't know if you've ever read the books of Brene Brown, and I'm a big fan of hers. I think that a lot of healthcare providers are very shame prone, and I'm shame prone, and that is a deep-seated insecurity that comes from the fear that we're going to be asked, when that mistake about us gets discovered, we're going to be asked to leave. And it has been, for many decades was reinforced by medical culture, the college bringing you in for a reprimand. You got a written caution, or you were brought in for a reprimand. You have been a bad doctor, and you must. And as if that is going to, I thought the colleges missed the point because most people that I know, most colleagues that I know, would happily take 10 years off of their lives if they could undo a mistake that they've made. They feel bad enough about it, and admonishing people to be more careful and all that. They're already shame prone. But the thing about being shame prone, about mistakes, whether it's on social media, whether it's on X, me making a mistake on X with a pronouncement, or on the air, or in medicine, is that you're terrified that once people discover your mistake, they will no longer want to talk to you or even have you in the same room. You'll be that doctor who makes mistakes. What I learned, I could have spent the rest of my life being completely depressed and anxious, or the alternative was, hey, why not follow the advice of Brene Brown, and that is to talk about your mistakes. And it was, I reached this fork in the road, and I took the fork that said tell people, and I started to apologize to patients because I'm not perfect, but I have a good heart, and I try not to make mistakes, and on the other hand, medicine's a very complicated situation. The system's complicated. The emergency department's chaotic. Just you ask for something to be done, a nurse tells you it wasn't done, and now you've got to order it again, and now there's so many complexities. What I discovered from patients is that they just want to know what happened, unless something grievous happened and they were grievously injured, or there's a death, and then we have compensation for that. We have the litigation system for that, but for the rest, people don't want to be placed in a cone of silence. They just want to know what happened. And if you tell them what happened in a straight up voice and apologize and sit down, don't talk down to them, sit down eyeball to eyeball, I found more often than not they forgive you. So it was do it one way or do it the other way. And I can tell you, when I get my back up on social media and I just don't want to apologize at some point, Brian, just say you were wrong. It works better. I hope that answered your question. That was a whole speech. Next.
Hello. The first panel spoke very eloquently about the relationship between vulnerability to disinformation and mistrust in institutions. And I was wondering if you could talk a little bit about the relationship between medical disinformation and vulnerable populations that have been harmed by the medical profession in the past.
So by vulnerable populations, I'm going to assume you mean people who come from minority groups. Perhaps they've arrived from other countries. So yeah, they're definitely at risk of misinformation, of being vulnerable to misinformation, because They may not, they don't understand the cultural nuances. They may not speak the language, the dominant language that's being promulgated by authorities in this country. They may have, if we're thinking about Scarborough, we're thinking about Peel, Peel region, Brampton, they have, highest rates of diabetes and high blood pressure, the highest need for medicine, and the lowest concentration of physicians and hospitals and facilities. So there's that. They may come from countries where they've been persecuted, and it's not just communism. It's countries where they may have been tortured. Iran, for instance, a lot of people don't trust authorities here because of their experience dealing with authorities in Iran, Africa, countries in Africa as well. Add all of that up, and unless the information they receive from their relatively closed community is accurate, then yeah, they're going to be probably more susceptible to misinformation than other people. And I guess one other thing, then there are the entrenched minorities, indigenous people, persons of color, who have been here longer, but have been subjected to testing, vaccine testing, nutritional experimentation, at Indian residential schools and other populations, and they have a good. So two things have happened. First of all, they have a darn good reason to distrust authorities here in Canada, and so they would be more susceptible to misinformation. And the other reason is that their genetics have been altered by their traumatic experiences of be they physical, emotional, sexual. And that alters their DNA, and so they pass the trauma on to their children. That's called epigenetics.
Hi, I wanted to get your take on vaccine skepticism within the medical community. During COVID, there were a number of stories of nurses and doctors being anti-vax. I was wondering if you've interacted, conversed with any of them, and with the overwhelming evidence that vaccines work, and the training these medical professionals have, how could they fall for this misinformation, disinformation? And then if they could, what hope is there for the rest of us?
So I've had conversations. I've had conversations with people, fewer medical doctors, but there are some. I would say more other healthcare providers, and I don't get into arguments with them because I have to work with them, and I would fall back on what Alex and Bruce said in the first part, or I think Alex talked about it in particular. You cannot identify any particular group that is more susceptible to misinformation, and it is not a function. It is not invariably a function of level of education or type of education. It could be, I'm just speculating here, it could be that person who is a skeptic had a horrible thing happen to a loved one in their family, at a formative time in their lives, and they thought it was, that it was due to medical misadventure. Maybe it was an obvious medical misadventure, like malpractice. Something bad happened, and they never trusted the healthcare system again. Maybe they became healthcare providers because they wanted to get some kind of a mastery over healthcare. I think that's why a lot of us, mastery over disease by becoming somebody who ministers to people who have those diseases. But I'm just speculating here. The bottom line is that it's not, you cannot identify one single group with a set of characteristics that will define people who are more susceptible to misinformation, and for that, and therefore healthcare providers are part of the general population. Are they just as susceptible? Maybe not, but there is a certain cohort that is.
Time for one more, I think. Hollis, is that?
Yeah.
Unless you're all sated with all of the... There's somebody back there? Okay, we'll go to the back for one more.
I grapple a lot with these issues of uncertainty and expertise. I think those can be sometimes I feel like they're opposing forces in a way. I actually don't think they are, and I think we need to be able to have concepts of expertise that include ideas of uncertainty. I think that's important for an expert to be able to be uncertain, as you've alluded to so far. Do you have any suggestions, either on a personal level or a societal level, of how we can kind of model expertise to include aspects of uncertainty as something that's important and expected?
Yeah. So a few things that I would recommend. First of all, say it, speak it. Medicine is applied. It is not science. It's applied science. That whatever might be true of a population may not be true of you or you or you. That's the second thing. The third thing is that, you know, some of the masters of medicine, Sir William Osler talked about you know, great Canadian physician who started medical schools both at McGill and at Johns Hopkins, talked about uncertainty. And so uncertainty is part and parcel of good medicine, teaching patients that it's part and parcel of good medicine. And it's not, you know, people are in a hurry to get certainty. Explain to them that if you're in a hurry, you're going to be applying more cognitive biases. You're going to make more mistakes mistakes of commission by being in a hurry. Ordering extra tests instead of taking a good history and physical and actually listening to a patient is not like ordering a whole bunch of extra tests and doing CTs from the top of the, you know, from the top of your head to your toes is not the way to get a faster diagnosis. And just say that's the way it is right now. The more we force certainty, the more we're going to make mistakes. And it's not either you wait forever for an answer or you get an answer right now, instantly. There's a middle ground where you just lean into uncertainty. I want to take another look at this. And I'll tell you, when I do my night shifts, the best time for me to make diagnoses is a surprising time. It's after I've stopped seeing new patients at 6 a.m. Then from 6 until 8, that's the time when I can go back over patients that I've parked overnight, and I'm taking a second look, a third look, and that's when I'm formulating my thoughts better because I'm no longer pressed for time. Just lean into it a little longer. And you know, that's how good teams function in healthcare. They invite people, everybody, no matter how high up or how green they are, to say what they see and add to the information of the team. And so you're going from individual cognition, me thinking, to team cognition. And when you have team cognition, you're going to have a more accurate diagnosis, and you're going to have a richer, because you're going to be pulling ideas out of left field that you wouldn't have thought of before, but for somebody who, with a still small voice, had the willingness to speak up. And you want to create an environment where they can speak up.
Speaking of good teams, it might be time to check in on our Toronto Maple Leafs. Ladies and gentlemen, Brian Goldman one last time. Thank you so much.
Thanks to Dave for pitching in, for pinch hitting. I guess there's no pinch hitter in hockey, is there?
No pinch hitter in journalism. Sure there is. Thanks so much for coming tonight. And thanks to all of our other performers.